Good evening, everybody, and welcome to the final webinar of the 2013-14 school year here for Pennsylvania AFERD. I'd like to thank you all very much for being with us tonight. I'm Todd Bedard, the webmaster and webinar guy for Pennsylvania AFERD. Just a couple of quick announcements. If you do have a company that is interested in exhibiting at our convention, that registration is now open and is on the website. So if you would like to register for our convention for your company, that is available at this time. We also have up on the website hotel reservation portal is open. So if you are planning on attending the convention, you know what days. We don't have the registration ready to go yet because we're still finalizing a few things, but hotel will sell out. It usually does. Reminder that meal plans are included. And if you would like to make a hotel reservation, that link is up on the convention page of the website as well. So do stop by and register for your convention room. We are back at Seven Springs this year, and it will be from November 21st through the 23rd. We can't wait. And as we do head into the summer, we will be doing some things over the summer. Keystone Health Promotion registration is open, and you can get that through our website. Penn State is taking care of that, so if you would like 3 graduate credits, you certainly can join Penn State and attend the 3-day Keystone Health Promotion Workshop. That is in June as well, and registration is open for that. So we'll be updating the website over the summer and keeping you abreast of things as they change. The SLO webinars will be posted in the members-only site tonight, and so they will be available for members as well. If you attended the webinar on SLOs last month, you can still use your registration. I did send out that recording link, and feel free to view those because they will be taking shape next year as part of our teacher evaluation in Pennsylvania for the 14-15 school year. So before I turn it over to Dr. Bill Kohl this evening, we'd like to introduce you to Martha Harris, who is our co-sponsor for this evening. Her company, Physika. She'll have a few words for you, and then we will turn it over to Dr. Kohl for the presentation tonight of educating the student body, taking physical activity and physical education to school. Turn it over to Martha Harris.
Well, thank you, Todd, and good evening, everyone. Thank you so much for joining us, and a special thanks to Dr. Bill Kohl for taking time to share the very good information from his report published by the Institute of Medicine last May. This is National Health and Fitness Week, so it seemed like a very good time to focus on the report 1 year later. Dr. Kohl is a very distinguished epidemiologist who's been working in the fields of public health and physical activity really for 30 years, and he's encouraged to see some progress in that regard. And I think for everyone on this webinar, those are key topics of deep concern to us. So we look forward to hearing from Dr. Kohl. He works at the University of Texas School of Public Health and is on the executive committee of the Michael Dell Center for Healthy Living. So with that, I'd like to turn it over to Dr. Kohl.
Martha, thanks, and Todd, thanks for setting everything up. Good evening, everyone. I guess most of the participants are in Pennsylvania. A soft spot in my heart for Pennsylvania, as my mother grew up in Western Pennsylvania, so I always like going home again. It's a pleasure to be here tonight. Martha, I think this got its start more than a year ago, and Martha and I met at a President's Council on Physical Fitness meeting in Washington, and I'm very pleased to have been invited today to share the results of some work that I was involved with other people much smarter than I on behalf of the Institute of Medicine. Martha indicated it was a year ago that the report was released. Actually, the draft report came out just about a year ago. The final report came out in early October of 2013. So we're really only 6, 7, 8 months past where the final report is. So I still kind of like saying it's fairly new, and I think it's still getting some traction around there. My sole purpose today, this evening, is to cover some of the rationale of the report. And then the 6 top-level recommendations. If you're a physical educator, I think every one of them apply to you. If you're a parent, every one of them apply to you. If you are a principal or a classroom teacher, every one of them apply to you. In fact, if you have the health of children in mind, every one of these things applies to you. I think what this report has done is it has helped strengthen the position of the physical educator as center to this. But as you'll see as we unfold uh, and unpack some of these recommendations here, we're really talking about much more than just physical education as well. Martha indicated that in a kind of sidebar conversation we were having on text before we started, do you think we're making progress? And I thought for a moment, of course, I've been working in this field a long time, so if we haven't been making progress, then I really haven't been doing anything. So I obviously think that we are. But one indicator, I think, is particularly as it relates to physical activity, uh, is the amount of attention that the topic gets, the topic kind of writ large, independent of other kind of things. And I've been working for many, many years on a crusade almost to make physical inactivity and physical activity a separate and distinct discipline in making it a health priority, not just lumping it with nutrition or not just lumping it with, quote, other health behaviors and so forth. I think the overwhelming scientific evidence is that physical activity and physical inactivity are really crucial for many, many health outcomes. And as we'll talk about with this report, children and adults, um, independent of other kinds of things. And one indicator may be this prestigious Institute of Medicine. This report is the third in a line that has really made physical activity and physical inactivity top line in the last 4 years or so. All of these have been funded by the Robert Wood Johnson Foundation. I'm pleased to have been involved in all of these. First in 2009, the Accelerating Progress in Obesity Prevention, where physical activity was a key topic of consideration. Fitness measures and health outcomes in youth followed a year later. And in this report, Educating the Student Body, focuses specifically on physical activity and physical education in schools. If that's any indicator of kind of the nation's premier advisory group, independent advisory group, that physical activity, physical education are getting we're making progress, if you will. And I think that's a useful thing to remember. I'd like to think that there will be more activity. Of course, more reports doesn't equal more action, but I do think that we're starting to get some traction with training and other kind of things that make this a top-line health concern that really wasn't there 15, 20 years ago. Everyone knew you should exercise, but that was about as far as we got. Really weaving it into the public health consciousness is where the progress I think we've been able to make. So what I'm going to do for the next I think 35, 40 minutes or so, and then we'll have time for questions, is cover this report. The Institute of Medicine is an independent group. They don't accept, industry can't buy their way into a report. They have rules and they're governed by a key set of rules that make them independent. Everyone on the committee on committees has to declare potential conflicts of interest, financial and otherwise, and it's a very well-run organization. The fact that we're now finding a lot of attention to physical activity and physical education, as I indicated earlier, is very, very gratifying. I'm going to cover this report. It's free as a download if you haven't heard about it, or if you haven't had a chance to order the full paper version. You can certainly get the PDF. It's a pretty long report, so but it's user-friendly in PDF, and you can get it from the IOM website, www.iom.edu/student body. I can maybe Todd can put that into the text box so people can see that again. So each IOM committee, as they're seated, is challenged with a statement of task, and each committee is able to modify that in a certain under certain parameters. But the funding agencies and the group that got together to stimulate the committee that results in reports and other actions gives broad frameworks for the statement of task. Really, what we set out to do was threefold in this group. Reviewing the current status of physical activity and physical education in the school environment. Second, reviewing the influences of physical activity and physical education on short and long-term cognitive, physical, and psychosocial health and development in children and adolescents. And then third, as appropriate, as the evidence allows, we were tasked with making recommendations regarding approaches to strengthen and improve programs and policies for physical activity, physical education in the school. So we had bullet points there. You can see it. I'm not going to read all of them, but this was a group of very, very accomplished people. I was lucky enough to be asked to chair, but the work was very well distributed. We had a very short period of time with which to work to put this together. Actually, less than a year, all of this work was done. And I think most importantly, we had, as a member of the committee, Jane, Jane, oh, now her name's slipping. She's the head of Miami-Dade Physical Education and Health, and she was just outstanding. Jane Greenberg, thank you, and was very, very crucial in not just helping drive us to what the evidence says and so forth, but making all of our recommendations practical and useful for people in schools. This would be just another, I think, dusty report if that didn't happen. And one of the things I think we really tried to do is be very clear about what can be done, how it can be done, and what I'll cover a little bit today is who should do it, who should be doing it. This isn't one more indictment of physical education. This isn't a hand-wringing report that's saying how we need to put more work on the physical educators. This actually gives physical educators a lot of ammunition because it points to people from elected officials all the way down to parents and children as people who are responsible for helping enact some of these things. So I think we've gotten some good traction, particularly with physical educators who see this as a win for supporting their efforts in a broad way. One of the things that drove us is not just the realization that we need one more good PE program or good PE teacher, or one more walk to school program, or one more playground, or set of nice shiny playground materials to be able to focus on physical activity. Where the field's going these days, particularly in public health, is a realization that a systems approach really has to be taken. We can't just say focus on a policy and hope that everything comes along, but rather here on the left-hand side, this kind of system, school system, understanding the entire system that includes policies and regulation, mobilization of support, partnership use, program elements, certainly, as well as the built environment, how those things interact in a continuous and organic way was a really kind of a critical realization for us. In other words, we weren't just going to recommend one more good PE program to be able to solve this problem. We took a step back and looked at the entire system and came up with this idea. It's not new necessarily, but the way this has been framed, I think, is somewhat innovative. This idea of a whole of school approach, and that's spoiler alert here. It takes PE, recess, classroom activities, active transport, intramural, extramural sports, reduction of sedentary behavior before and after school time as a system to be able to help us to use the school really as the hub to help children get 60 minutes a day of physical activity. And it is possible. It's not just a real good PE program. It's not just all of these things individually. Taken together as a system, what this report gives a lot of ammunition for is making the school the hub where the 60 minutes a day, certainly when all the kids are in school, whether it's year-round schools or 5 days a week or so, but 60 minutes a day of physical activity is achievable using school as a hub for physical activity. So we kind of combine systems thinking into this idea of a whole of school approach. This is a kind of an interesting. This was kind of an interesting exercise here too. Most people say, "Well, just strengthen PE policies and you'll be good," or strengthen walk to school programs and you'll be good. And while it's certainly reasonable to assume that a strong whole of school approach has to include policy changes. The evidence, certainly when we began this, was somewhat thin, but we also had this realization that what starts out as a policy, as for example, something a federal guideline or things that the recommendations from the Federal Department of Education is meant to go down to the state level. That's meant to go to the district level, going around in the circle to the school, the classroom. And then the center is what we're all interested in, which is students' physical activity opportunities and experience. But the realization, the reality is there are different measures of implementation. These three different weighted, weighted lines indicate that there can be a law maybe without any assistance for implementation or any enforcement of implementation. And the thicker line is meant to indicate the existence of laws and guidelines that have come with assistance, say financial or other kinds of implementation assistance, as well as some kind of measure of surveillance of enforcement of those laws. Each step along the way, too, going from federal to state to district, so forth, there is loss. This is not a perfect system where there's no energy that's lost to the outside. At each step, the intentions of a law sometimes are thrown out here, out of the circle, out of the system, and only partially distributed down to the state level or even implemented. And you can follow the same kind of logic all the way on. So that ultimately at the teacher level, the classroom level, the physical education class level, you can't just depend on strengthening one law in one place, state PE requirements, we've heard that for years, or district requirements, things like that. The understanding of these policies has to understand what's leaking out here in this system, where the efficiency drops off, and working to solve that problem as well. So the point of this is not just a it's not just a top-down kind of thing. The systems approach has to include that, but it has to understand these effects as well as other approaches that we will talk about. We started with a set of guiding principles. These are principles, touchstones that we used each deliberation, during each of our writing sessions, during development of the guidelines and so forth, or of the recommendations, that we took to be true based on our experience, the literature and so forth, that helped us move things forward. So, for example, instilling lifelong physical activity in children and adolescents is crucial to the nation of the health. Systems thinking is needed. There are very real disparities in physical activity and physical education, and these have to be eliminated. So we consider that in all of our deliberations. All types of school, not just public, private, or the schools that have good tax bases and other kinds of things. Student diversity, obviously considered, and we clearly we're guided in our work by putting in using the best available scientific evidence, as well as promising approaches that are in the field. So These seven, one, two, three, four, five, seven, guiding principles really helped us bring us back to reality and help guide our discussions. One of the, I may have done only one good thing in this whole thing, and while everyone else did all the work, but as chair, I really insisted on a kind of a conceptual framework with which to operate, so that we all had a common landing ground. You understand we had developmental psychology types on the committee. We had physical education types on the committee. We had physicians. We had a vast group with a group with vast experience, wide experience, and not everyone brings the same perspective, as you might imagine. So we use this theoretic or this conceptual framework as our touchstone in these things. Our ultimate outcomes here, for example, in our literature review and other things, is not just the health and development of children, but the idea of academic performance, this holy grail that I think we're really getting much closer to these days in terms of the role that physical activity plays in academic performance. Intermediate outcomes here, some of them measurable, some of them not, include social engagement, physical activity, competency, motivation inherent in children, impact factors that focus all the way along all of these: quality, scalability of programs, reach, and sustainability. And here the money shot really is in these five categories, where we're looking across the programmatic policy approaches. Physical education certainly is a center, but including and reviewing the effectiveness of classroom physical activity, recess, before and after school, intramural, extramural sports, and active transport to and from school. We took this as a whole systems approach, and then the foundation on which it was built: policies, built environment, various programs, partnerships, stakeholders, and monitoring and accountability here. All of this pyramid, if you will, or kind of a weird-looking pyramid, really drove our conceptual framework, and we worked in each of these boxes to try to complete this idea of whole of school approach using this picture, if you will. So what does it look like? Michael Beetz from the University of South Carolina came, and some of you may know some of his work. I think we could have invented another graphic, but I think his does a very nice justice what this idea of whole of school is, and why we should be looking at the school to be the hub for physical activity. The 60 minutes a day recommendation. Certainly during the school day, you got 6 to 7 hours. This is a group of professionals. I don't have to tell them this. 6 to 7 hours of contact all the time. If it breaks down, there's classroom, recess, and physical education. Bell to bell, that's what we're looking at in terms of the school day. But there's also maybe 60 minutes or so before school, with a portion that could be developed in an active commute to school. There's after school time that takes on it has various looks and so forth. After school programming, certainly intramural, extramural sports, that's an additional 2 to 3 hours. So you're looking at 11 to 12 hours here, conceivably, with which to extract 60 minutes. And I think that that's a very realistic way of thinking of the whole of school approach, not just focusing here on what we all know to be an effective, if it's quality, physical education, but taking a step back and looking at the system and understanding that it's physical education plus all the rest of these things that will help us get to the 60 minutes a day. One thing I forgot to say is, if you would like to post some questions in the chat box, I'm monitoring that, and I can stop. This is kind of a natural place right here before we get into the recommendations. Feel free to do that, and or comment, not just a question, any comments, so certainly welcome as well. With that background, I think we had 4 meetings over the course of 10 months and put together this report that I think is one of the more comprehensive reviews that included everything in this conceptual framework. Oops, now my animation's not working, or it's going the other way. Everything in this conceptual framework. And really importantly, the work that Chuck Hillman at the University of Illinois and others are doing, this academic performance box is really starting to fill up with information. I think it's pretty clear now that active kids, we used to say that academic achievement and, there was, well, we're not doing any harm and things like that, all of which is true. But some of the brain scan studies and other acute physical activity studies that are going on right now are really starting to show that kids who are physically active think faster and can process information better, have really better measures of executive function, which we haven't really been able to say simply by looking at test scores and other kind of things over the last some years. So this is really a promising area. And I don't think we could have written this report as forcefully as we did, say, even 5 years ago, before some of these data on academic performance and physical activity had come out. Let me go back here and start with the recommendations. It's about 6 o'clock, or 7 in Pennsylvania. So what are the recommendations? Well, if you haven't heard by now, it's a whole of school approach. But what does that mean? And one of the key things here, pointing here to the first recommendation that we did, is we identified actors. We didn't say, well, there should be 60 minutes a day of physical activity in schools. So what we pointed out, district and school administrators, teachers, and parents should advocate for and create a whole of school approach to physical activity that lets kids have a chance to be active 60 minutes a day to meet the guidelines. Importantly, more than half of which should be accomplished during school hours. More than half of which should be accomplished. So 30 minutes in that bell-to-bell time is what we envision there. And not surprisingly, it's focusing on physical education and that 30 minutes. Half of the PE time should be spent engaged in that physical activity. These are not new. These are maybe polished up recommendations from, well, it's not NASP anymore, but the recommendation should be familiar to any physical educators in the audience. Elementary school students, because of scheduling another 30 minutes a day, and high school students 45 minutes a day in physical education class. Curriculum scheduling, you can maybe do 150 minutes a week if you don't meet every day, for example. Pointing out the rest of the school day opportunities, and where these other things, active transport and others. Defining this in the top first recommendation, defining what we mean by whole of school, looking at who should be the actors and where that physical activity should come from. And then importantly, we didn't just say, well, you should do this, pointing our finger at people. We actually gave some potential actions. We illustrated potential actions that these actors could take on in a very real way to make progress towards meeting this recommendation. So, for example, state legislators and departments of education at the state level can adopt or strengthen PE and recess policies, so they align with national recommendations for minutes, as well as the amount of time spent actually being physically active. As most of you all know, there are national recommendations out there, but states and departments of education really across the country aren't aligned very well with that. That's a very kind of basic thing that the committee thought could make a huge impact really quite quickly, not making up new ones. State legislators and departments of education could adopt and strengthen before and after school programs so they align with national recommendations on physical activity standards. Those things are out there. Not anything that we're making up new. It's trying to point all of these boats in the same direction, if you will. And then, we even went to the built environment. State legislators and legislatures and departments of education can adopt school siting policies that encourage schools to be located in places that are walkable. Here in Texas, we're putting schools 30 miles out of town and waiting for the towns to grow up around them, and it just doesn't seem to be making a lot of sense for physical activity, obviously. So again, not everything is on physical education. Is what can these actors do? Uh, Create a mobilization and engage in this effort. Make it a priority at national, state level. PTOs and PTAs, school health advisory committees, and the like. Those kind of organizing bodies should be able to ask this question each time they make a decision. Districts and schools, for example, can strengthen these policies. That certainly can be done at the school level. Increase the amount of time physical activity can be done in classroom breaks. That doesn't have to be at the state or district level. It can be right at the school or principal level, incorporating physical activity into academic sessions. I think Physika does this. Several other people talk about active learning these days. Intramural sports, physical activity clubs that are importantly accessible to all students. Pay to play is a popular model. Not all students have a chance to do that. And so making it a priority that these kind of things are accessible to all students who want to participate is critical for this at the school level. Joint and shared use agreements use physical activity facility or school facilities and other things, playgrounds and the like for physical activity programs outside of school. And then who's the champion? Who is the champion in the schools? And this is a veiled, not so veiled, but a call out for districts and schools to elevate the importance of physical educators in schools to lead these efforts. Certainly, physical educator is the most trained person to be able to do these kind of things, working with classroom and teachers and administrators and others. That kind of work can be useful and position the physical educator as the expert in this particular area. Parent groups, schools can also do that. And we also talked about municipalities. It is something that is oftentimes foreign to people in school districts and others. The departments of education and the Department of Planning rarely talk to each other, or school districts rarely talk to city planners and so forth. But consider renovating schools that are already in existing neighborhoods. Again, the active transport idea. Traffic calming and control strategies so that there are safe, active travel routes for biking, rollerblading, skateboarding, and others. I guess I dated myself by saying rollerblading, but skateboarding and other kinds of things. That can be done. That's not the school's responsibility. That's the cities and local governments. And then look at policies that can encourage schools to be located, new schools in residential areas. The second of the 6 key recommendations is one that you kind of say, well, duh, why isn't this being done? And we've heard a lot of media attention, not a lot, there's been media attention these days, and people clucking their tongues and other things at school policies that have maybe banned sugary drinks or certainly cupcakes and sweets for class parties and so forth. They're considering nutrition as part of all school-related policy decisions. We absolutely, as a committee, thought that should be a similar priority for physical activity. Federal, state governments, school systems at all levels, city governments, planners, PTOs, and so forth, should systematically consider access to and provision of physical activity in every policy decision related to the school environment as a contributing factor. So the idea that there should be everyone asking the question, well, how does this relate to physical activity? How does this policy decision help us improve or maintain physical activity in children, in our kids? Should be the question asked with any policy consideration that schools would look at. So here are the actors. Designate individuals specifically responsible to ask that question. Sit on those committees and shacks and other kind of things that specifically is responsible for getting up every morning and wondering how physical activity can be part of any policy decision at the school level. develop those objectives, work with the principal, work with the district administrators and so forth, so that there are objectives that kids can achieve during all segments of the school day. And then organizations like Pennsylvania AFERD, the state AFERD, and others to emphasize this and embed this thing as a priority into their position statements. We started out talking about have we made progress. I think it'd be a huge step forward if every decision at school asked the question, what about physical activity? And I think what this recommendation is meant to do is foster that. This is the third recommendation. It probably generated the most conversation and made people the most uncomfortable because it's really a big picture thing. Why isn't physical education a core subject? Why isn't, with the evidence that we have, why isn't it designated by the U.S. Department of Education as a core subject? My elevator speech when I talked, when the report came out and so forth, was that, hey, we have spent literally billions of dollars on school nutrition programs before school, breakfast and lunch. Excuse me, we've spent billions of dollars in screening for health, scoliosis, hearing, vision, scabies, anything you want, all of which is intended to have healthier kids who learn better. It's time that physical activity took a priority with all of those other things that help kids be healthier. And this is one critical aspect that we thought that could work and make it not just with money and other kind of things, but accountability that comes with designating this as a core subject. So U.S. Department of Education, federal, state public health agencies, as well as NGOs have some actions here. What are some innovative application of physical activity that can happen, as well as highlighting the outcomes of there? And then schools and school departments, departments of education need help. Advocacy materials from NGOs. Disseminate these things, educate people, make physical activity a priority. This can happen. This and one of the key potential actions that the committee thought was critical to point out. Number 4, we oftentimes felt as if we were in a dark room all feeling our way around to find the exit because of a lack of data. I'm an epidemiologist by training, and so my one qualification is that I can count things. And many of the important outcomes, participation in schools, even PE policies and other kind of things, data are missing. And we spend an awful lot of time hunting and pecking and searching and piecing together data from multiple sources. But we can do an awful lot better in terms of having data. If it's important enough to measure, if it's important enough to, if it's an important issue, it should be measured. And we're not doing a very good job in these. So a top-level recommendation here, and this isn't all on the education agencies, but public health agencies as well, at multiple levels, should develop and systematically deploy. Emphasis there, not one-time surveys or one-time measures, but systematically deploy data systems to monitor policies and behaviors pertaining to physical activity and physical education in the school setting. You can't make decisions if you don't know where you are or where you want to go. And so these are absolutely critical pieces that are missing right now. And we thought it was important enough to make it a top-level recommendation. So, for example, the Departments of Education and Health and Human Services could collaborate to ensure the availability and publication of information about school physical activity and PE-related policies, as well as the behaviors. Routine surveys, YRBS data obviously only gets high school, and the school health policy programs and policies survey only comes around every 6 years or so. there are giant holes in what we need to do, and particularly measuring this idea of whole of school approach. This can be done if it's a health priority. We've seen it in other issues related to public health. These national agencies can facilitate collaboration among state and district departments to get these data as well as publicize what's going on and set goals and so forth. So we can improve the YRBS, NHANES, and specifically to capture more complete student, there's a typo there, complete student school-related physical activity behaviors, complete student, and then facilitate this collaboration. Local districts in this regard can regularly assess student achievement of PE standards. Not necessarily, obviously, fitnessgram's another issue, but how well are schools and districts doing to achieve these PE standards, as well as physical activity? How close are you getting to 60 minutes a day? It's possible to get those data now if it's a health priority. These systems need to be collected and publicized at the local school and get parents asking the question about what physical activities are my kids doing these days. Augment things such as Fitnessgram to include physical activity related behaviors as well as student achievement. Putting them together, the committee thought it would be an interesting approach for local school district and schools to do. And then finally, utilize another example. These aren't exhaustive lists, obviously, but to utilize current systems of collecting physical educational information within schools to monitor the quality, not just whether or not they achieve it, but the quality of PE, as well as the usual dose of physical activity. Again, measuring these things that we think are important, we're not close to doing that. And the top level recommendation from the committee was to develop these systems. People here, if anyone who's working in schools, I hope will be supportive of this. You can't do this, obviously, without developing training for teachers, teaching teachers how to do this. We can spend another whole hour talking about physical education training, physical education, teacher education training programs, and so forth. The committee recognized, though, we needed upstream training to do these kind of things, not just throwing teachers in and saying, okay, go for it and do it. But not just professional development, pre-service training as well, taking a look at how new teachers coming out can actually be thinking about opportunities for physical activity at all levels for classroom as well as PE to develop this whole school approach across the curriculum, physical activity opportunities, not just in PE, but not just in the classroom, but raising the awareness and the skill sets that teachers have coming out of colleges and universities, but also during continuing education trainings to focus on emphasizing, well, classroom teachers say, well, that's the PE teacher's job, not mine. And that's not what we're talking about here. We're talking about all teachers. All teachers being able to be asking the question, where does physical activity fit in? Departments of education and local school districts can highlight, for example, how to do this, exemplary training programs, and give them best practices, integrate them into continuing education training as well as university pre-service training. Develop competencies. These things you all have been talking about for years, I'm sure. Requirements for competencies in physical education and activity so that people come out with a certification and key training in this area. Finally, I was struck, and I don't work in schools every day. I'm an academic, and I get that. I was absolutely struck by the evidence out there that even if some kids want to be physically active in schools, they can't because they don't have access. There is a broad diversity in access. There are data that show that kids from largely Hispanic schools actually don't have as much opportunity for physical education than schools that are largely non-Hispanic. And those published data really got our attention, and we wanted to make sure to point out that this is not something that should be just available to schools and school districts where they can afford to do this and they have a good tax base, but that should be for all schools and all students in all schools. And it starts at the top and works all the way down, that all levels, the programs and policies, all levels address existing disparities and reduce them, and that all students have equal access to appropriate facilities and opportunities. And that's not just able-bodied versus, not just all able-bodied students either. It's students with any disability who has the ability to be able to participate. Actions, Department of Education and state departments and so forth can make this a priority by conducting an inventory of facilities, condition, type, safety, lighting, other kind of things that are available. Just measuring it first and foremost can make it a priority for change. And then at the local level, schools can review these existing opportunities and really shine a light on the barriers. Shine a light on the barriers. Who's not participating? Why not? Is it safe? And making it accessible to all kids as part of this idea of the whole of school approach. The committee, lots of times these IOM reports are heavy on research recommendations, future research, and of course that keeps academics employed. But we chose in our group to not spend an overt amount of time to develop a huge set of research recommendations. There's obviously more research that everything needs to be done. I've listed 8 or 9 here that are part of this. And I think they are the short list of things that really need to be focused on. This isn't necessarily a research group, I get that, but I wanted to point out that a lot of these questions help drive the recommendations, what's in the recommendations and what isn't. For example, everyone thinks they know that the built environment is important for physical activity, but we don't know what the specific features are. Is it a certain playground built to standards, or is it school siting, or is it an interaction between the two? Is it multiple stairwells, a layout where it's flat versus vertical? In an architectural setting, from an architectural standpoint, a lot of work needs to be going on there. So we identify these things. We didn't. It's not. The audience is not for researchers, but we wanted to make sure that we realized that we don't know everything we need to know, and that the field would be advanced there quickly if these questions were addressed. Excuse me. We put together several bits of information, consumer information, infographics, handouts, things like that, that can be downloaded for free and printed. One that's very effective, I think, I've asked Todd to play here. It's a short video infographic that can be used in any setting that you're in, whether you're teaching kids, whether you're, and here it is. Go ahead, Todd. That's fine. Thank you.
Our youth population is suffering from physical inactivity. Over the past 30 to 40 years, the volume and intensity of daily physical activity among youth has gradually declined. In the United States, only about half of youth meet the recommended guideline of at least 60 minutes of vigorous or moderate physical activity each day. A lack of activity increases the risk of heart disease, diabetes, osteoporosis, anxiety and depression, and other diseases. Recent studies have found that in terms of mortality, the global public health burden of physical inactivity approaches that of cigarette smoking and obesity. Physical activity improves other aspects of health and fitness, including aerobic capacity, muscle and bone strength, reduction of anxiety, depression and stress, self-concept, and academic performance. 48 to 69% of students did not attend physical education classes in an average week. Since the passing of the No Child Left Behind Act, nearly half of school administrators reported cutting significant time from physical education and recess to increase time spent in reading and mathematics. Given that children spend up to 7 hours each day in school and many attend after-school programs, it is important to examine the role schools play. The opportunity to influence so many children at once makes schools an extremely attractive option for increasing physical activity. The Institute of Medicine recommends a whole-of-school approach to physical activity, allowing for at least 60 minutes per day of activity that is of vigorous or moderate intensity, where at least half is accomplished during regular school hours and the other half occurs in the school environment. This is where the majority of youth can be reached, regardless of their socioeconomic background. Physical activity should be included in recess, dedicated classroom activity time, active transportation, before and after school programs, intramural and extramural sports, and in physical education classes. Let's educate the student body. For more information, please visit www.iom.edu/studentbody.
Great. I guess my mic is back on. I see that Todd typed, yes, it is a public domain. You can download it. I encourage everyone to download it and embed in any of your teaching materials and any of your advocacy materials, say when you're talking to the principal or so forth. There are also other kind of things, fact sheets and other things online that are free and are meant for broad dissemination of these recommendations. I try to do these kind of webinars and other kind of talks to get the message out, particularly to people who are on the ground doing these things who know about this but need the backup and support, particularly from the scientific standpoint, to make these things happen. So um, I don't have anything additional. I wanted to acknowledge the people who actually did all the work here. Just a terrific group of people from all over the country of various backgrounds and really made my job a heck of a lot easier, as well as the staff of the IOM here. They were an exceedingly professional group and really helped make this whole thing possible. It's always a pleasure to work with members of the IOM. Okay, that's what I have. We have, I think, 10 minutes or so. Todd, or Martha, I moderate, or people can type questions, however you want it to happen.
Folks, if you'd like to type some questions into the chat box, we'll just take them one at a time and work our way through them, and Bill will make sure everything that you have questions about gets answered here before we get out of here for the night. So if any of you have questions, the chat box to the right is available, and go ahead and ask away if you'd like. I think we have a few coming here, Bill. While we let these people type their questions, folks, too, I have recorded this whole thing, and we'll be sending this recording out hopefully this evening. If not, definitely tomorrow. And you should have this available to use and view on your own as well. So.
Okay, Carrie, I'm seeing here, what's your recommendation how to get superintendents and other administrators to listen to this wisdom? Well, I think there's a variety of ways. As I said earlier, my qualifications end because I don't work in a school district or in a school area to do this. I do think that One of the key things that Jane Greenberg reminded me of all the time, and others who I know who work in this field all the time, is that school districts and administrators respond to demand. I get asked that question when I speak in front of parents. And the one thing I say is, have you as a parent, gone to your principal and asked, how is this school helping my child be healthy through physical activity? And if she or he says, well, we've got PE 1 day a week, that's not good enough. And not just from the people on the inside who know it, physical educators and so forth, but uh, responding to creating a demand from the parents, I think, is a huge question or a huge issue that unfortunately many parents these days are of the age when PE was PE and roll the ball out and come back in and make fun of people and so forth. And it's changed. The field has changed, obviously, but parents need to value this a little bit more. So I think a lot of what can be done, particularly for teachers and others, is asking their parents to go to the principal or to the school health advisory council or other kind of things to create this demand. Are there data that show, yeah, that absolutely that works? No, I don't. I can't point to those data, but I do think that it's a responsibility of those positions at board meetings and other kind of things to raise these as parents, as concerned parents, just like screening for influenza might be, or not screening, but it's like I said earlier, screening for um, uh, hearing and eye screening and scoliosis and the other kind of things that have been traditionally in that area. If it's a priority, if we think it improves the health and learning of kids as much as the data say it does, then it should be a priority and it should be demanded. That's one suggestion. Note from Martha here. A few months ago, ASCD and CDC released a new paradigm called Whole Community, Whole School, Whole Child model, replacing coordinated school health model. The model is consistent with the IOM recommendation. Yeah, it is consistent, Martha, to the extent that I know, in that it's an acknowledgement of this systems approach. It's not just, say, relying only on the idea of the coordinated school health model, that the school can be the place where all of these kind of health services and other things can be offered, but understanding the system in which the child lives. And it's not just the school, but it's the community, the family, and these other kind of things. And I think that the systems approach is kind of an emerging area that the IOM report that we did, at least the thinking behind it, as well as the new paradigm is starting to embrace. And I think that it's not just about what the new program is and how well you measure in the short term, but taking into things such as unintended consequences of various programs and how to prevent those. What are some accelerants? What are some barriers? What are some other kind of things that might be able to be recognized rather than just plopping down a program and hoping for the best, if you will. So I think that the common thing is that they share the systems approach. Linda Huber, we need our physical educators to be on every wellness committee in schools so that we have the ear of those and make this. Yeah, you're absolutely right. What this, as I said, it indicated earlier, while this indicates that it's not all physical education with the report, what it does indicate is that it sets up very nicely. The one person in schools and school district that has the expertise in all these areas is, in fact, the physical educator. And I hope that it gives license to groups like Pennsylvania State AFERD, West Virginia AFERD, any other group or any other classroom teacher group to take a look at this and say, this has to be a priority. And we're looking around, and the physical educator is the natural one to take that lead and be on those wellness committees to advise the SHAC, to have the ear of one of the members, SHAC in Texas. I'm sorry, it's not the same way. The School Health Advisory Council. To have the ear of a key person on that school health advisory council in the district to be able to ask the question, get up every morning asking the question, what are we doing for physical activity? So I absolutely agree with you, Linda, about how to do that and the importance of that.
All right, folks, we'll give you one last chance if anybody else has any other questions for Dr. Kohl before we let him go for the night. Looks like there's a couple of people. Looks like Martha's in there as well. So Martha, I made you a host too, so if you want to enable your mic again at all, you certainly can do that as we wrap up here.
Okay,
Like
well,
Carrie.
thank you, Todd, for again organizing such a good event. And folks want to learn more about how to be strong advocates for everything Dr. Kohl shared with us. We strongly encourage you to look at our active learning specialist course, which is up and running through Harrisburg University, where we're really training educators like yourselves to become the change agents that can take this good data and set of recommendations and apply it immediately in your school environment.
Once again, on behalf of Fazika and Martha Harris, we appreciate your partnership in making this webinar possible this evening. And to Dr. Kohl, thank you so much for taking time out of your busy schedule to join us here in Pennsylvania. And for any of you from far away, thank you also for joining us. And I know we truly appreciate your work.
I apologize, my mic was off before. Thanks very much, everyone, for participating, and for Bill for giving us your time. And thank you, Todd, for getting the link out to all of us for the recording. Appreciate it.
Very good. It's been my pleasure, and I look forward to progress in this area. And just as we started, Martha, I think this is progress. I think this is a big step forward.
It's a big step to see, a group like the Institute of Medicine take this on, and with such a good and thoughtful report. Really, thank you to you and all of the people who put that report together, and the fact that you're continuing to give us tools to help get the information out. Both the infographic and now the video infographic are very persuasive tools that we can all use in our daily work with educators. Thank you.